Good morning, good afternoon, and good evening to all of you, and thanks for joining us from across the world. It's my pleasure to welcome you to this important conversation on healthy aging, a topic that is not just timely but critical as we collectively navigate the demographic, economic, and health transition shaping our societies today. Let me start with a few numbers that offer a context to why we are here. According to the World Health Organization, by 2030, 1 in 6 people in the world will be aged 60 years or older. By 2050, the population aged 60 plus is expected to double, reaching nearly 2.1 billion. In Asia alone, we are witnessing one of the most rapid aging transitions, with countries like Japan, South Korea, Singapore, increasingly China and India, facing a shift that will redefine everything from workforce productivity to national health budgets. But let us be clear, aging is not a crisis. It is a triumph of public health, of science, of policy, and human ingenuity. The question we must ask today is how do we make this longer life healthier, more dignified, and equitable for all? This webinar has been designed to explore exactly that. We will look at the multifaceted challenges that comes with an aging population, including the increasing burden on caregivers, rising out-of-pocket expenditures, giving prevalence of chronic conditions, and the often overlooked impact on mental and societal well-being. But more importantly, we will shift the lens to opportunities, to how we can reimagine care models that are not only sustainable but also proactive. From integrated primary care and technology-driven support to community-based health systems and policy frameworks that prioritize prevention over reactive care. There is immense scope for systemic innovation. Let's also acknowledge that this is not just a medical or policy issue. It's a human one. Aging well is about autonomy, social connections, purpose, and access. Access to information, to infrastructure, and to quality care regardless of geography or income. Throughout today's session, we will hear from thought leaders and practitioners who are pushing the boundaries, whether through new technologies, financing mechanism, or public-private partnerships. Together, we will explore how to bring about a shift in a mindset, from care for the elderly to partnership with an aging society. I encourage all of you as attendees and my fellow panelists to lean in, ask questions, most importantly, imagine a future where aging is not seen as a burden, but as a continuum of thriving, contributing life. Thank you for joining us. Let's begin. We do have an amazing panelist with us, and the way we're going to structure is we're going to start by having a keynote address from our very dear Lars from McKinsey. And after that, as all of the panelists, we're going to get into a conversation on the topic which I just talked about. So really looking forward, Lars, to your keynote address, and I hope the technology is working and you can show your slides. So look forward to you. Let's begin. Over to you, and then we'll have our fellow panelists talking about the overarching conversation. And maybe if you can start from a quick introduction from your side before you do a deep dive on the topic.
Yeah, very happy to now keep the introduction very brief and also my remarks brief so we have time for discussion. So Lars Hartenstein, I'm speaking to you from Paris, and I am the Director of Healthy Longevity at the McKinsey Health Institute. The McKinsey Health Institute is a non-profit generating entity or institute within McKinsey, and we are focusing on underinvested areas of health. And healthy longevity is one of such underinvested areas of health that we are prioritizing along some others like brain health, women's health. I look forward to sharing this with you, but the exchange with the panelists, of course, is important. So I'll really try to set the scene a little bit and talk about health and then end on investment themes. And then we can engage more broadly. Now, let me see whether the sharing works, but we should. Can you see my screen?
It's coming through. Yep, here it is.
Excellent. So I'll talk about the secret to great health, a perspective on healthy longevity. See where that moves as well. Okay. Do you see the next page now?
Yes.
Okay, now to get us started, so there are three different levels how we can really think about aging and healthy aging in particular. First of all, and all of them are linked to issues and also areas of innovation. First of all, there's, let's say, the biological study of aging. My Paris neighbor, Guido Krömer, has started with the hallmarks of aging a few years ago, and there are 14, now I think 14 different biological processes that are identified as on the level of the cell to be about aging. Now, every body has 30 trillion cells. So the next level that we can look at aging is really the modifiable drivers at the level of individual. At the level of the individual, I'll focus there because my understanding of the context that we have here, that's probably the most interesting. The first column here is very much technical, biomedical innovation, very interesting field, but I think less our topic today. And then lastly, we have 8 billion human beings. There's a level of the community, places like Singapore or so are considered innovators on that. But what needs to happen in terms of the awareness, the intersector design, cross-sector mobilization on cross-departmental policies and regulations to really advance on healthy longevity? So just to say the lay of the land, because I think very often we are sometimes going from one to the other and so forth. I'll majorly focus on the middle today, because in terms of new value proposition, that may be one of the most fruitful ones for the kind of conversation audience that we have and the conversation we want to have. So now, what is keeping us from moving forward in healthy longevity are a bunch of orthodoxies that are linked a little bit in our current way to look at health. How I'm going to set it up is talk about a few of those. And here's the first one. We said, as Aman said, health on some level is a remarkable success. Health expectancy has increased a lot, so that's great. But at the same time, we are paying a very high price for this increase in longevity, namely about 6 months in less than great health for every 12 months that we add. So that is a pretty terrible deal on some level. And I think as we are discussing healthy longevity, our responsibility or our task is to negotiate a better deal, to reduce the suffering that we are collectively endure as we statistically all can look forward to 20 plus years in less than great health. So this means sometimes we can talk about this as squaring the life curve. So rather than having a low, long decline, we want to be in great health as long as possible, then a rapid decline. That's, if you want, health span maximization, but that's what we're trying. That's what this is about, right? To staying in great functionality as long as possible. Also, I'm going to do this quickly, but this is of course compounded by the fact that we're all aging. So not only we're having more and more life in absolute in less than great health, but there are more and more people that are in the phase of age where these kind of years of life in less than great health accrue. So therefore, it is an ever more critical topic. So now we are thinking typically about health as from an orthodox perspective, very much focused on physical health. That's where 90% of the resources and the research goes. When we asked 19,000 people across 19 countries, we actually found out that people value their physical, mental, spiritual, and social health at just about the same in a similar order of magnitude as their value their physical health, suggesting there's a, let's say, opportunity optimized capital allocation in terms of what people actually want. They're also highly interrelated. For example, a heart failure patient who's lonely is 4 times more likely to die than a heart failure patient who's not lonely. Next orthodoxy is that health is really about the absence of disease and death, so mortality, morbidity. There's a binary distinction. If you ask your doctor how healthy you are in the absence of major disease or risk factor, normally he or she will say that you are quite healthy, you're fine, right? However, the way to think about health is really in functional dimensions. So what can you do versus not? if we ask 40% of the people who are functionally healthy actually have a major disease. Yeah. So, and the functional notion is much more important. If you're 90, let's assume for a second physically healthy, but there's a difference. I'm sure you'll testify whether you're sitting at home looking at a screen or whether you can sit on the floor playing with your grandkids. So I think we can aspire for more, and the functional definition is critical to really think about where best to innovate in this field. The next one is that is a link but different, is that we are thinking about health as a binary, that you either are sick or not sick, but in reality, health is something on a spectrum that we can improve and optimize for everybody. It is a useful discussion if when 93% of US citizens are in ill or not in ill metabolic health, one can talk about the improvement in metabolic health for literally everybody, not only for those that are patients. It's a people/consumer question for everybody. In the same way that, by the way, I'm not sure how many of you participating today have thought about their knee flexion in middle age, but your knee flexion in middle age is quite predictive on whether you're going to use knee surgery later on, though most people only worry about it when they're pretty close to knee surgery. So now we looked also based on evidence and science, what is really driving health. And there are about 20 drivers outside of conventional healthcare that are highly influencing health independently. And those do not only include diet and exercise, the proverbial, I'm always want to say diet and exercise, but also sleep, social connection, stress levels, exposure to nature, exposure to the environment more generally. So therefore, there's a significant opportunity to address drivers outside of health. And by the way, a tentative estimate that we have done in terms of the latent demand in this area is about as big as the current healthcare sector in total, the conventional healthcare sector in total, around about at $10 trillion. Just for giving you a sense, the overall wellness industry right now is about $2 trillion. That suggests there's a lot of opportunity for business models centered around health and healthy longevity. And all of those drivers, I should say, are also highly modifiable, right? And that's great news, because if they're modifiable, there's an opportunity for structured offerings. So to make all this happen, I'm going to make this brief. Everybody on the planet and every industry has a role to play, be it as an employer or not. And we have achieved large-scale societal shifts in the past. One of my most favorite examples is the second column here. When COVID started, at least in my environment, let's say my parents said they will never wear masks, that's outside of their social imagination. Later on, they wouldn't see any of us, including my kids, without masks being worn, right? So I think large-scale shifts are possible, and the fundamental shift from, let's say, sick care to health, not health care, really health, is one of those societal shifts. And I think there's a lot of optimism that we can go forward on this. And let me just close on this slightly different angle, but like if we really take a step back and look at this at healthy longevity more from an investment theme perspective, right? I mean, the 20 drivers are a useful starting point to think about innovation and offerings, but like if you really take a bigger step back and look at investment themes, those are 8 that we are highlighting. And by the way, there are also publications linked to some of the things I've presented, and I'm sure we can share this in the aftermath also. So you have more detail on file on these. But let me just, rather than going through, I'm gonna just call them out one by one. So social participation, hugely important, is also very predictive of health, but also what people really want. Doesn't have to be work, but can also be volunteering, but also after 60, 65, 70 to participate. Investment science, that's really much also linked to the very first column on the very first slide. So the entire cellular aging dimension is very important, but overall, there's much more work to be done to understand health span science, or the science of health span more broadly. Of course, as Aman said, the need to continuously evolve and strengthen healthcare, that goes without saying. The addressing the social determinants that we know very well, that includes health literacy and all these topics, highly important as well. And then also on the right side here, topics about that are first not so closely connected to health, but around public safety, financial inclusivity are also important, and the nexus between wellness and health is definitely a critical and fast-growing market with many value propositions within it. So that was a little bit a tour de force, and I'm going to take the slide off so we can see each other, but just to provide a couple starting points for discussion and map the overall universe of opportunities that is in front of us.
Okay, thanks, Lars. I think this has been really amazing and insightful. Despite the fact that I've been sort of looking into this subject for a while, I think some of the thoughts which you brought onto the table are really kind of, how do you say, they drive the conversation on this topic. It starts to make you sort of think beyond what we have been thinking. As you said, you have to look beyond the orthodox thinking which exists about aging and longevity, especially what stood for me personally is about how health is more than the absence of disease or death, how most of the drivers sit outside of health, especially when it comes to longevity, and how especially the 8 potential avenues for which we can influence healthy aging. I think out of the lot, I think those really sort of stood out for me. Let me now bring in rest of our panelists into this conversation, and if I can ask my tech team to ensure that all of us are kind of visible and not just a spotlight on me. Hopefully my tech team will get everybody in here. And if I can ask the colleagues to sort of, have their camera on and mics on. So guys, so let's sort of, what I would like to sort of really do is, ask my fellow panelists, Stefan, Shaun, Sasaki, Lena, to sort of do quick introductions of themselves, and then we're going to do a little deeper dive on this really interesting topic. So, the way I kind of look at maybe, Stephen, if I can ask you to sort of do quick introduction and then follow that with the others, and you can sort of go about doing it, and then we sort of get really more insightful based on what we heard from Lars, as well as your own personal perspective.
Great, thank you, Aman, and great to be here. So Stephen Johnston, longevity fellow at Sompo Digital Lab, and I lead a company called Forecastle, which is an innovation consulting company based here in Melbourne, Australia. So yeah, really enjoyed Lars' tour de force. And from my background of setting up Aging 2.0 10, 12 years ago and building a global network of 100+ startup chapters around the world, very much interested in the tech aspects and the data. And I'd say if I want to kind of briefly give 3 seeds of thought for the discussion, one would be this data piece. Who is owning the data? How are we giving the data back to the older people and not just the big tech companies or the big health companies? So thinking about that would be exciting for me. Equality would be my second point. Longevity equality is fascinating and fast growing. It's probably even more uneven in terms of longevity outcomes than health, than income and wealth outcomes. And so we're seeing this big exacerbation that we have some people living the Warren Buffett lives healthy to the very end, and others, frankly, really struggling. And then my third piece is about place and the future of aging, as far as I can see, as the future of place. There's no point living healthy lives, doing exercise, low stress, living the best life, and then living in a place with forest fires. And we've seen in California the increase in dementia based on pollution from forest fires. So I think this idea that we need to take a place-based approach would be a big factor for me as well. Happy to be here.
Thanks, Stephen. And I think we will sort of do a little deeper dive on all the three pointers we sort of said. Let me sort of ask maybe Shaun for you to do a quick introductions.
Yes, of course. So thank you very much. It is a real pleasure to be here. So my name is Shaun Matisonn. I'm an actuary by profession, and I've been with the Discovery Group for the last 30 years. And I currently lead our global efforts to expand the Vitality program. We're currently in 42 markets around the world with 42 million customers. And I guess our hypothesis is that there are really two institutions that can monetize the benefit of good health. Those are governments and insurance companies. And our experience is using techniques of behavior change to create programs in combination with insurance products and other financial services products to really bring about positive behavior change to effectively square the health span curve that Lars was talking about. And our experience with a particular focus on physical activity as a wonder drug is that we can be successful. And I think Lars's challenge on those ambitious other social changes, we do think through the power of technology and Stephen's point about data, which is something that really does require us to come back to, I think we can make profound change to kind of square that health span graph. But it is leveraging the financial benefit and the financial incentives we get from the insurance value pools. So I'll leave those thoughts out there for discussion.
Perfect. No, thanks, Shaun. And yes, as I said, we gonna go a little more deeper because one is ensuring, the longevity, access to quality of life, but also who pays for it. How do we ensure that it's kind of taken care and it's more sustainable? Let me ask, Sasaki-san to sort of come in for a quick introduction, and then I'm going to ask Lena for her to do the quick introduction, and we're going to get deeper more into this thing.
Sure. So it's a really pleasure to be here. My name is Minoru Sasaki, currently working for Japan's Ministry of Economy, Trade and Industry. This is a trade ministry inside Japanese government. And I am a middle management of healthcare industries division in METI, which is in charge of prevention, facilitating innovation in the field like prevention and health management and exporting medical devices into emerging markets. And also the important field is aging for me. Something like, for example, recently we are now encouraging some patients participation model, co-development model in dementia, and also like planning some collaboration with local government in nursing care field. And also we are now funding for some research and development project which supports evidence making in prevention in dementia and frail, etc., related to nursing care field. I'm especially interested in how we could create a sustainable model which facilitates both private sector's innovation and also supports supports funding for such nursing care and aging collaborated by private sectors and public sectors. So yeah, looking forward to talking with you.
No, thanks, Sasaki. And I think definitely we would sort of do a little deeper dive about the care models for the aging population and what the rest of the world could learn from you. And I think that will be really, really kind of an interesting. Let me now bring in, Lena to sort of do her introduction and of course, provide her perspective. We're also gonna hear her in the later part of today's webinar from her perspective from a venture capitalist. So Lena, over to you.
Yeah, thank you so much, Aman. Good afternoon, everyone. Good morning. I'm Lena Rogovin from 3L or LiveLong.Life. We're a specialized investment and advisory firm focused on digital health technologies that promote healthy longevity. So in a nutshell, we invest in and advise early stage Israeli and US companies with innovative solutions in three key areas, which are early detection, diagnostics, and preventive care, as well as chronic disease management and care coordination. And our team brings deep global experience in healthcare and health tech growth and investments. And on top of that, we build an extensive expert network across the US healthcare ecosystem, from public agencies and payers to providers and medical equipment manufacturers, all of whom help our portfolio companies to and our advisory clients to navigate this complex landscape. And today I'm going to provide a health tech investor perspective on longevity investing. I'll talk about the main pillars of healthy longevity, about the market opportunity, and about the gaps in the system.
Thank you, Lena. Thank you all for quick introductions and providing a quick perspective. I just realized that I forgot to introduce myself. When we started, I got too excited. So my name is Aman Gupta. I'm the managing partner for health and purpose practice with FINN Partners. And thanks a lot for joining me in here. So let me sort of, get into the conversation. I think one of the first things which I would like to really talk about, which, Stefan sort of brought in, is the whole aspect of inequality of, kind of an outcomes, longevity, and the quality of life, across the world. But I think one very important part, which Stephen, you brought out, was the whole thought about future of place per se. So while you may have a great ecosystem, but if your planet health or the way you kind of staying is a problem area, and I'm sort of coming because personally, when I look at it in my mid 50s, and I say I'm trying to do everything, but then staying in, Delhi NCR in India, which half of the time of the year has really an AQI level, in the kind of a severe kind of a category, it does raises the question about what does that kind of a mean. So, I think as a panelist, and also then, attached to that is the whole aspect of the affordable in terms of who is going to pay for it. So, Stephen, if I can ask you to sort of come in and do a little bit more talk about what does this future of place mean, and how do we sort of work towards ensuring that not just the people health or the longevity part for the aging population is there, but also the planet health and the place where they're staying is kind of taken care of. How is that kind of the two sides sort of brings the balance, and the role of the different stakeholders in this thing. So, if you could sort of elaborate on that, I think that would be really insightful and exciting.
Yeah, I'll kick things off, and I'm sure my fellow panelists will have strong opinions on this too, but just a couple of data points. Chicago has a place called Streeterville, which has a life expectancy of 90, and then just next door is Englewood in Chicago with a life expectancy of 60. And so you sort of have this incredible diversity, and it's not just the US that has that level of diversity of outcomes, but I think there's a reality on the ground that the inequality issue and the place issue is totally connected. And I think that's the same when it comes to how we actually think about the solutions. The challenge, obviously, is that we are already finding it hard enough to get any kind of holistic, systemic, person-centric approach around healthy aging as a whole. And then you sort of have to add on sustainability and climate change and fixing place. And so essentially you come down to making better places. And I think that's where I would suggest is an interesting area to look at, which is bringing the governments, bringing the local governments in. There's a wonderful book called Localism by Bruce Katz a couple of years ago that talked about the future of the world in which we don't trust federal government. We don't have very good relationships with institutions, but we do believe that local institutions work better. And so I think that's probably, if I was to give one recommendation or thought, is like, let's bring in mayors, let's bring in the local teams to think about this holistically. They're the ones who can juggle the very difficult conflicting priorities between needs of the local residents and the businesses and managing the income expenses. I would just add a final point about, which maybe also connects, which is how we get those mayors and the local councillors to decide on what objectives, what measures are important. So one thing, for example, in the US, and I think it's the same in Australia, the local officials and the planners were objecting, the objective function was how quickly can a white middle-class male commute to work in a car. And that was the objective function of how their city planning went. And so that just rode roughshod over local inhabitants who just wanted to walk to work, or women who were not treated fairly by the stats. So I think the numbers that we focus on and the local institutions that we use are going to be two key areas to look at in this to address some of this inequality topic.
No, thanks, Stephen. And if I can sort of ask the other fellow panelists to come in, because you brought in a perspective of the role of the government, especially at kind of a local level and not like really at a federal level, and what can they sort of bring in. So maybe Shaun, from your side, because we talked about the whole aspect of insurance and the paying part of it. So that's usually done at an individual level, or at an employer level, or at the government level. Now, with what Stephen talked about, which is the the planet health or the environment in which you're staying apart from the human, do you have any thoughts in terms of how do we ensure as the people staying on this earth that whatever is required is kind of paid for, this enough funding to ensure that the environmental shifts which are happening is taken care of, apart from, of course, the overarching, managing the planet health?
So, Aman, thanks. I just to backtrack a little bit on the question of equality, which is interesting. So what we've seen in terms of our experience is, on the one hand, when you sell insurance products at an individual level, that's the most appropriate, that's the most effective way of creating change, because as soon as you go up a level to an employer or a government, there's like a layer of disconnect in terms of engagement. And our challenge is always, particularly when we sell to large employers, is how do you get engagement of individuals? And so our experience is, if you use financial incentives carefully, you can really enact change. And that's very powerful in a question of equality. So we spend a lot of time in the US, where our clients are very wealthy Americans, to dress up financial incentives around partnership with Apple Watch, etc. And turns out people all over the world will do extraordinary things for a free cup of coffee. But notwithstanding that, like, we're trying to make money go further, but financial incentives are very powerful in motivating change and can be used, in our experience, to address, at least within the insured population, some level of equality. But then when you go to your question around the environment, I mean, I agree with Stefan that must be done at a local government level. We've thought quite carefully about how to create financial incentives for individuals to make better choices around climate change, and it's very difficult. It's very difficult to measure. With health, it's easy. We can measure our physical activity today, whether it be sleep, whether it be VO2 max. We've got so much data, and we can make a distinct link between the data we see, the change an individual makes, and the incentives we give. Whereas you start to think about them at an environmental level, it's much more difficult to do. And we've been thinking a lot about it, but we haven't cracked that problem. So I guess our view is we can create lots of equality in terms of the provision of care, both at an insurer and a government level, using financial incentives very, very powerfully. But I would say local governments can be much more effective in terms of the environmental aspect, thinking about the problem more holistically. That would be my view.
Thanks, Shaun. And I think I was just sort of going back to the conversation which we had a couple of weeks back when we were preparing for this webinar, and you talked about the kind of role of behavioral change, towards the kind of a health risk and how it needs to be built into the kind of an insurance product. So can you give some specific example of what you may have seen, what sort of really worked on that side of it? Because I think, as you rightly said, it has to be done at an individual level, while we may look at other layers. But is there anything which you would like to share with our audiences on this topic?
Yes. So a few quick points to make. One is, I think we've been particularly focused at the moment on making sure we've got individual measurement around the choices you've made. What does that impact your own lifespan and your own health span? because we found it's much more effective to generate behavior change by making things much more personal. The second is using financial incentives. And we found that very, very powerful in terms of, for example, weekly incentives of meeting your physical activity targets, or more macro incentives, discounts on things that really motivate you, like travel, in terms of meeting holistic health goals. And then most importantly, being very personalized to help people build habits. And so what we've learned is and I think this is where the future really sits, is in the healthcare space as opposed to the environmental space. Everything is becoming much more personalized. So we need to know where you are today and what the actions you have to take to get you off the couch or continue if you're doing a great program. And those are the things that we're focused on, making the individual information relevant, use financial incentives, and then really be much more personalized to build habits. That's really where we're focused at the moment.
No, thanks, Shaun. And I think it's really, I would sort of say, not just interesting, but I think that's where the future is, because, how an individuals make the right choices and is provided the right kind of ecosystem and incentive to do the right choices is how the health would be really delivered. So it's not just about giving you treatment, but also the choices which makes to remain, prevention to ensure that you remain healthy. And I think I'm going back to what kind of Lars talked about. Most of the health drivers sometimes stay out of the treatment. It's more about holistic health, which you're kind of talking about. I think here I would like to, Lena, to sort of bring you in, as an investor. You heard what Lars said, you heard what Shaun said, you heard the other panelists. When you are looking from an investment side of it, and the kind of startups, technology companies which are there, what's been kind of your view as an investor? What's really happening in this system, and what's the direction you're saying the companies are taking? The kind of the kind of introductions they're doing. What's kind of innovations which are happening?
Okay, thanks for this question, Aman. So from our perspective, longevity is basically preventive care. And when we look at it, we look at three key pillars. The first one is behavior change. The second one is early detection. And the third one is advanced diagnostics. And in each of these three pillars, we see huge gaps between supply, demand, and funding. Just to start, like as an example, to start behavior change, which is probably the most important part of all these healthy longevity topics. So on the one hand, we know from various sources that 80% of chronic diseases, chronic conditions are preventable through behavior change. And we know that about half of all health outcomes can be changed for the better, changing human behaviors. But on the other side of this, we see that only 6 to 10% of total venture funding in digital health industry is going to this to funding this segments of the sector. And the same thing we see in terms of wider preventive health financing and the overall situation. We focus on the US market, and we see that in the US, the disproportion between reactive care and proactive care is dramatic. It's like $10,000 per patient spent annually on reactive care, like hospitalization and medication and treatment of acute diseases, acute cases, versus slightly more than $700, which being spent on preventive care. So that's like on the one hand, it illustrates huge gaps in a critical problem in healthcare system in general. On the other hand, it's a huge opportunity for both innovative companies and investors to fill this gap. And we see a lot of great companies, a lot of great technologies focused on Israel. So we see like tens of companies addressing this preventive care. But in terms of adoption, it's going very slow, and it's like it is improving. Like according to the latest stats I saw, the technology adoption in the U.S. healthcare is increasing by 45% annually. But still, early stage startups do not always know how to who is the right person to approach, and on the client side, if it's a payer or provider, it's not a standardized process, so it's not always easy for for two sides to meet, and we see making this connection and making this connection make sense for both sides, for innovative companies and for clients. It's a part of our offering to startups we work with, and we believe that this is where the difference is.
Thank you, Lena. I think I'd like to bring in kind of Sasaki-san into this, and just going from what we discussed in the past, what really will be useful, and I'm trying to connect the dots between what Lars says, Stephen, Shaun, and Lena. That if you can give a perspective from Japan, what's really happening in Japan from a care models for the aging population, and what can the rest of the world learn from there? But also, I think, if I'm not mistaken, you talked about an event which is going to be happening in Osaka somewhere in June. I think it would be useful for both our panelists and audience to know more about that, and how Japan maybe can collaborate with certain other economies. So Sasaki-san, if you could sort of talk more about that.
Thank you for introducing some of my jobs. So the first and foremost, as you may know, Japan is #1 aging society in the world, and we've implemented some public nursing care insurance 20 almost 30 years ago, and the most of the care which would happen in, for example, in nursing care home would be covered by public insurance, and this is supported by citizens' insurance premium over the 40 years population. So, but now, as you may know, the number of the elderly population in Japan is skyrocketing, continually skyrocketing. So the funding, as a result, the funding for nursing care is also skyrocketing. So right now, we are now trying to incorporate more private sector's technologies. For example, this is a little bit weird, but going back and forth between the nursing care home and their housing will be covered by that insurance. But between the hospital and the housing will not be covered the healthcare nursing care insurance. So this is why the private sector's support for such nursing care field would be really crucial, and not only such low technology, but also something like high technologies, like for example assistive robotics, which would help caregivers in nursing care homes, something like that. So a lot of opportunities and innovation possibilities would be in the aging field, but the problem might be like, as Shaun previously talked about it, but how overall stakeholders would collaborate and create such innovation ecosystem in nursing care field. And in Japan case, we've started from the public sectors, but as a result, this might be related to what Steve said, but right now, local government previously they were doing only welfare and social care, social worker aspect inside their community, not so much for innovation. But now they are required to facilitate um, private sector's innovation in local community, but they don't know what they should do. So we are now, bridging the barrier between the local government and private sectors and facilitating the collaboration. And once we, create the good model in some local community, then we want to disseminate to entire Japan in the Japan areas, something like that. So this is one. You asked me how Japan is approaching to the aging and nursing care field. In the last three, we would have some global conference event, which will happen coincide with Osaka Expo at the end of June. And one of the important topics would be healthy longevity and aging innovation. So Steve will be a moderator and a panelist for one session. And also we would welcome a lot of stakeholders from across the world. We would expect 400 participants and panelists. And also we would expect online participants as well. So if you are interested in for all of the participants today, I want to disseminate the information through the LinkedIn, so please follow me.
No, thank you, Sasaki. And I think really having this conference later in the June, I think would be really useful for the everyone is sort of interested in longevity, and we know that's the way the direction is happening. What I want to do right now is just want to sort of give like a 30-second or a 45-second to each of the panelists on something which we heard earlier, that it's, if you look at it from a longevity or kind of an aging population, we are talking about both the physical, mental, and the social health. And especially, I think the social health part of it is becoming increasingly important and is linked to the mental and the health part of it. Where we sort of, I think the example was somebody with an heart failure living lonely has a 4 times more, probability of, having a fatal incident versus somebody who's sort of, socially more active. So if I could ask each of my fellow panelists to talk about that, how do we look at delivering the physical, social, and the mental health? Or is there a perspective from your own lens of how that should be kind of incorporated as a part of the future, as we look at an increasing aging population? So, and again, I really don't have a specific order, but I'm looking at the people on my screen. I'm going to sort of bring in accordingly, but if anybody wants like to go first, that's also fine.
I'm happy to go first.
Perfect. Go ahead.
So just, I mean, I agree. This question of social health and social cohesion, especially as we get older, I think we all agree is super important. But it's a real challenge as how to create it. I mean, our thoughts are in terms of what we're doing. So the point I neglected to mention earlier, just going back to Stefan's point about equality, one of the things we like to do in the program is wherever possible use our scale to remove barriers to customers engaging in healthy activity. So reduce the cost of a device, the cost of healthy food, the cost of a gym membership. And so we think, are there institutions which at a very local level that we can reduce the cost of people getting access to more socially cohesive activity? So that's one area where we're exploring quite carefully in markets where we have older populations, and we have a big client base, over 1.5 million customers in Japan. And the second is then leveraging our community. So as I said earlier, we've got 42 million customers, 1.5 million customers. How do we create a community within ourselves, within whether it be us as an insurer, an employer, a local government, and use that as a way to create behavior change. Because perhaps the last point is, well, all of the activity that Lena spoke about is really about non-communicable diseases, but in our experience, often, obesity and metabolic disorder is often contagious because we mimic the behaviors of people around us. And so we try to do as much as we can within our client base to create that social network and create cohesion and positive change.
Go ahead, Stephen.
Yeah, thanks. Following really, I think what Shaun was saying, the concept of aging in place has become very popular, and frankly, it's been the sort of policy goal for probably like 20 or 30 years and hasn't really had a huge amount of impact. But I do think there is, here in Australia, for example, there's a big shift happening right now and an expectation that we are going to be shifting people out of aged care and congregate care back into the community, or not have them leave in the first place. And I do think that there's some unintended consequences of this, which is very much in the social realm, which is going to be a massive isolation and loneliness epidemic, even more so if we succeed in taking care of the physical care need with our wave of robots or new immigration policies to allow to meet the demands of the care staff that we have, or the care shortage. But I think that, again, comes back to the infrastructure that we're building. And I was just at a council meeting earlier today, and it was actually really interesting. We were talking about bike lanes in the local area, but it was also a perfectly social, engaging topic in which we had older people, younger people. There was a 5-year-old, there was an 85-year-old. And I do think there's something interesting about rethinking democracy and bringing people in to the city sort of decision making, and having older people and younger people jointly decide and agree and discuss what the future of their place looks like for them. And I think even in the process of talking about it, you'll probably address some of the social isolation concerns.
Thanks, Stephen. Lars, do you want to sort of come in, because this is a conversation started from you, so I would love to really bring in kind of you here to sort of maybe add more kind of layers to this conversation.
Yeah, sure. I mean, just a few comments. Very interesting discussion. Number one, I think it's also important what one can do in the short term, let's say, in terms of social isolation, social health, what you've mentioned. And one example that I quite like is in South Korea, where the latent demand of older adults to actually that are not yet completely, that are still capable to do something, actually are very keen to get involved on a voluntary basis. And they have kind of introduced in Japan, there are things like this as well, where matching mechanisms in some ways, where people searching for opportunities to volunteer are finding them at that age, which is not a straightforward thing, and that can massively have massive benefits. It is not that difficult to start, but doesn't exist in a ton of places in the world. So that just because the one is not only about bricks and mortar, but there are other, let's say, easier infrastructural things that one can do. Second one, I fully agree on this focus on communities and cities. And when we looked at, every national government of the world has a top level official that is looking at health. That's only true for about a third of larger cities in the world. Yeah. So I think establishing cities, places, local communities as actors in health, and wherever in different contexts, make it part of their priority, I think is in very, very fruitful, and historically in many geographies neglected, a neglected aspect, and I fully agree with that. And then I think on the topic of behavior change that came up now, of course, we are also speaking here to investors and innovators, right? Behavior change is a very fruitful topic. I think we need to also let it happen, because the challenges that we are putting with behavior things very much on the individual, right? Where at the same time, and obesity is a very good example for this, right? Pure behavior change will only go so far. It's the most fruitful avenues there are more like system innovation, yeah, and where one enables people to actually behave differently, and there the city has an important role. Innovators have a role to play, but also broader cross-sector dialogue has a role to play to make, to Shaun's point, it's governments and insurance companies care a lot, but employers also. So how can one establish new constellations to make behavior change possible? Yeah. So anyway, those are just a few comments on the conversation, but like fully on the same page with overall perspectives shared.
Thanks, Lars. Let me ask Sasaki-san to join in because you didn't bring in Korea and Japan. So, especially from a social part, Sasaki-san, anything from your side you would like to add what you have seen happening in Japan on the whole social wellness part of it?
Yeah, I'm completely agreeing with all of your ideas. And I also think a societal aspect is really important for healthy aging, especially like you guys said, talk about it, but how to create inclusive societal community. This is really important for not only for elderly people's emergency, but also their behavioral changes. And also like, their mental health could be supported by local community as well. For example, the number of elderly population living alone in Japan is continually growing. So, how we will be able to create infrastructure to accommodate them. And also like right now in Japan, the number of family caregivers are also increasing, and they have to balance between their work and their caregiving. So I think how we could support for such family caregivers are really important as well. And I think in this case, the the term community would mean not only physical community, but also would include digital community as well. I think right now SNS is well developed. So, and also family caregivers would be living in the distant places from the elderly people. So we could be, we will be able to augment the um, the term community to more digital one as well. So this is my idea.
Thank you, Sasaki-san. Okay, no, thanks a lot all for these comments. Lena, if I could bring you in here because we are almost at the fag end of a webinar. I would have loved to have it much more longer, but I think this is where I sort of bring you to do a more deeper dive on the role of the venture capitalists in this bit. So the spotlight is on you now.
Sure. Thank you, Aman. So actually, I have a couple of words to add on this social health topic, since it's one of our favorite areas and we're big believers in its growth. So on the one hand, as it was already mentioned, we have a lot of awareness also on the government side and what happened after COVID, that all this topic of social isolation and loneliness became a mainstream. And in parallel, we have this technological breakthrough, and with all AI and Gen AI emerging technologies, it's becoming more affordable and accessible and scalable than ever. And we see a lot of companies offering hybrid human and AI coaching and companions and support groups and caregiver help. And I personally believe that it's one of the most promising areas in the digital health industry. So that's my input on the social health topic. And on a wider health tech investor perspective, in addition to this behavioral health we talked a lot about today. We also believe in early detection and diagnostic technologies. Again, first because of their scalability and their impact on people's health. That's in terms of outcomes and in terms of ROI, in terms of economic income. Like, for example, on early detection and early detection perspective, we all know how efficient is early detection, and the cost of treatment is dramatically differs if it's like, for example, for cancer, right? If we catch cancer early, it's 2 to 4 times cheaper than more advanced treatment. On the mental health side, again, early detection, like every dollar invested in early detection brings cost savings of $2 to $10. And we can continue giving these examples about like almost every clinical area for advanced diagnostics, for using AI for early testing. McKinsey, I think it's Lars number, estimates net savings of $360 billion, which is also not a small number. So that's probably the most effective part of health tech technologies, and with minimal cost, it leads to very significant savings. So it's a win-win for all the stakeholders in health and healthcare system, and that's why we believe that's the area where we should focus.
Thank you, Lena, and thank you, everyone. I think we are on the end of the hour, and I think I found this conversation really insightful. I think some of the points which each of you raised are something which will define how the future is, how the future of the aging population is, and how do we ensure that it's the healthy kind of longevity is not just about the absence of disease and death. I think we have a much more productive life. We have a much more healthier life, which is more about mobility, sociality, mental health, and the physical health part of it. But I would like to really thank each of you to joining us here for this really meaningful conversation. We could continue to have the conversations offline. Now you guys know each other, so do feel free to reach out. I would also like to really sort of do a call out quickly. I know he's listening to Levi, who sort of really made this thing possible. Thanks, Levi, for having each of us sort of come in. And thank you, attendees, for being a part of it. Feel free to reach out to any of the panelists to sort of ask any question. 60 minutes is not enough to discuss such an important topic, but it's a start. And I hope you sort of found the conversation, some of the insights really exciting. So with that, let me sort of bid adieu to all of you. Thanks a lot for joining. Have a great day in whichever part of the world you are. Thanks a lot for being part of it.
Thank you.
Thank you. Bye-bye.
Bye now.
Bye-bye.